So howdy and good afternoon. It is my pleasure to welcome you to the second installment of the Texas A&M University School of Public Health's COVID Conversations. I am Heather Clark, Research Assistant Professor and Director of Public Health Practice at the School of Public Health, and I will serve as the moderator for today's discussion with three of my esteemed School of Public Health colleagues. Please note we are recording today's conversation and we will make it available to the public early next week on our school's website. But before we begin, our webinar is set up so you do not need to worry about your video or your microphone. We cannot see or hear you. But because we want to interact with you today, as we move through this conversation, you can submit questions using the Q&A button at the bottom of your screen. Because there is a good chance your question has already been asked and is already in our queue, please hold off on typing questions until we signal that we are going to take questions. We will do so several times throughout the hour, answering as much as we can during our last 10 to 15 minutes. Today, we have a record number of registrations with over 500 people registered for the session, including over 100 questions submitted ahead of time. We have sorted and combined these questions into several topics: questions about COVID infection, transmission, returning to work and school, and prevention. Obviously, with an hour and 100 questions, we will not get to them all, but we will do our best. So stay tuned. We will have future installments, assuming you all find this very helpful. And please let us know today at the end of our broadcast in our evaluation. I am honored to be joined here today by Dr. Sean Gibbs, Dean of the Texas A&M University School of Public Health. Dr. Gibbs has over 100 articles in industrial hygiene and environmental exposure assessment, focusing on disrupting transmission of highly infectious diseases, and is a national leader in research, training, and policy in this area. His research helped determine national policies, procedures, and best practices in response to Ebola virus, COVID-19, and other highly infectious diseases. Dr. Rebecca Fisher is an assistant professor of epidemiology in our School of Public Health. She is an infectious disease epidemiologist specializing in rapid epidemiologic response and analysis during outbreaks and epidemics. She has expertise in detecting, suppressing, and mitigating emerging disease threats, including Zika, West Nile, and H1N1 influenza, hantavirus disease, and the ever-challenging antibiotic-resistant bacteria. She has led response and research activities on 4 different continents and is one of the few non-clinicians in the world with advanced certification in clinical tropical medicine and hygiene from the acclaimed Gorgas Institute. Along with Dr. Clendenin, Dr. Fisher has been working closely with the Brazos County Health District and state epidemiology team since COVID-19 first emerged in our region. And last but not least is Dr. Angela Clendenin, who is also in our epidemiology department at the School of Public Health. An instructional assistant professor, she has deployed to multiple disasters as part of the Texas A&M Veterinary Emergency Team as a responder and has experience in disaster and field epidemiology. Most recently, she has been providing surge support to the Brazos County Health District's COVID-19 response alongside Dr. Fisher. Doctors Clendenin and Fisher are also leading the way in the newly formed Texas A&M COVID Investigations and Operations Center. Okay, panel, are you ready? Because here we go. By now, we have all heard about contact tracing when someone tests positive. So, Dr. Clendenin, would you please describe what that process looks like?
So contact tracing is a critical part of being able to contain a disease and hopefully be able to mitigate it in any community. It begins when a case is identified through a laboratory confirmation of COVID, and that case is then contacted and interviewed about their symptoms and about their other underlying disease conditions in the hopes that we can get a better understanding of the disease. We then ask them to identify their close contacts. We then reach out to those close contacts. We inform them that they have been identified as exposed to COVID-19, and we make recommendations to them about getting a test as well as isolation so that we can get everybody who potentially has been exposed isolated from the rest of the community and break the cycle of transmission.
So you're talking about people being notified they've been exposed. Will they know who actually it was that exposed them?
So contact tracers are not allowed to reveal who they were exposed to. They are not allowed to provide the name of the case. What we have been finding in our experiences is that many of the cases have already reached out to their close contacts and informed them of the exposure. So they already have an idea, but it is up to the actual case to reveal their COVID-19 status. Contact tracers are not allowed to reveal who that case is.
Okay, well, that makes sense. Another question that was submitted ahead of time asked, where is all of this information stored? So if you collected information about me, if I were to be positive, where is that stored?
So we have to deal a lot with protected health information and personally identifying information, and it's critical that we protect that information. So we use HIPAA compliant databases that to store the information and even for file transfer. So that information is protected to the extent that HIPAA requires us to.
Okay, thank you. As we continue to hear about the number of people recovering from COVID, people are wondering about how long they might have antibodies for COVID and if that would protect them from future infections, which sort of ties in with another question that was asked. If someone had asked, could somebody have COVID more than once? Dr. Fisher, I believe you might be able to tell us more about this.
Yeah, well, this is really a burning question, isn't it? Not just for doctors and scientists, but just about everyone out there, particularly those who have been infected already or who are worried about being exposed. Unfortunately, my news for you today is that we just don't have the complete picture yet. You may have heard stories on the news or a few reports about some cases where people seem to have recovered and then later experience COVID-19 again. Mm-hmm. What is unknown in those individuals if those persons truly recovered and had no more virus at all and then caught it again later, or if they had partially recovered, may have even tested negative due to the virus being mostly cleared and fought off so that there was so little the test couldn't pick it up on the swab, and then maybe they had a relapse or continued illness. But a few sort of tidbits of information have emerged from both anecdotes like this and then real scientific research. And that's that most people do develop antibodies after becoming infected with SARS-CoV-2, which is the virus that causes COVID-19. Not everybody has a high number of antibodies, and not everyone keeps those antibodies for a long time. So it's looking like the antibodies are not going to be permanent in everybody, so probably not going to convey permanent immunity. Permanent immunity we think of when we get things like hepatitis A or when we get a vaccine for measles that will last our whole lifetime. This is also the kind of scientific answer we can't rush to find, since if we want to know how long somebody has antibodies and if they can if this can prevent them from getting reinfected, we really have to wait that out and watch. So we track people over time, and scientists, monitor those antibody levels. And then there are other viruses that we can learn from that we know stuff about. For example, the common cold, which is probably the best analogy, since it's reasonable to expect that people who recover from COVID-19 will have some immunity at least for the rest of the season and perhaps longer. So just like you might get the common cold again next year, it's possible that we might see that with COVID-19. But again, these are the kind of answers that we're looking for.
Sure. Well, that makes sense. To follow someone over time, we would really need a time machine to jettison us, 20 years in the future to see if they still have it. But that actually brings up an additional question. So if someone has COVID and they have symptoms, and then those symptoms go away, are they no longer contagious?
So if somebody becomes sick with COVID-19, the average person with a mild or moderate disease, being one that doesn't send you to the hospital, the person is really thought to be infectious for about 7 to 10 days after they first start to feel sick. And now it's not the same for everybody, and some people will recover more quickly and will be able to clear their virus more quickly than others. But it doesn't only apply to people who feel sick. So our best information right now is that roughly around half of people who actually become infected might not have any symptoms at all, or their symptoms are so mild that they really relate their illness to something like allergies, a hangover, working out too hard, and then other things, symptoms such as diarrhea, a rash, or excessive sleepiness or confusion that might not be linked to COVID in somebody's mind. But these are people that as well can be infectious. And then just quickly, the most important group that we're concerned about as when we're doing case investigation and contact tracing to notify people of their exposure are those people who have been infected but don't know it yet because they still feel fine. So the other part about being infectious is that you actually can be infectious before you even know you're sick. So the literature is showing that probably 2 days-ish before you feel the first signs of illness, you actually can be spreading. So think about all those family and friends and coworkers that you're around. And if you got sick and didn't know it, then those are people that potentially could catch that from you. So that's, to bring it back to Dr. Clendenin's comment about contact tracing, it's why it's so important to notify people of their exposure so that they're aware of this, and then they can use all those protective measures that we know to keep that transmission from moving forward.
Absolutely. Thank you so much. So speaking of spreading COVID, Dr. Gibbs, what actually can kill COVID-19?
Well, the good news with COVID-19, the disease, or SARS coronavirus 2, and the virus that causes it, is that it's a virus. Viruses are generally one of the organisms that we consider some of the weakest in the environment. So once it's outside the human body, there's a lot of things that will kill it. If you're looking for specific items, you can Google the US EPA's N list for COVID, and it'll have a list of all the compounds out there. But essentially, if you're using something to clean your bathroom or to clean your kitchens, it will kill coronavirus in the environment. Additionally, you've probably heard a lot of people talking about the differences between being inside and being outside. This virus, again, is very fragile, so it doesn't do well in high temperature and high humidity, something that here in Texas we've got plenty of. So particularly when you're outside in the environment, you'll have the higher humidity, the higher temperature, and you'll also have UV ultraviolet radiation coming down from the sun, which can also further deactivate the virus outside. You generally don't have those as much inside, so it's really those inside environments that you got to be concerned about. So again, outside, the environment will take care of most of it for you as long as you maintain good social distancing, 6+ feet away from each other. Once you're inside, you're going to want to implement a regular cleaning schedule. But the good news is most of the things that you already have in your home that you know and that you're familiar with will take care of this. One thing I will caution you about, because I see this kind of routinely when we're talking about infectious diseases, is people who aren't familiar with doing cleanings or haven't done them too often start mixing compounds. Whatever you do, do not mix different types of disinfectants. That's a good way to create chemical reactions and to create different types of gases that'll be very, very hazardous to you and your family. So take a look at the cleaners that you're used to using. See if they're listed on the list. Chances are, if they're good to kill Staph aureus or MRSA or things like that, they'll be fine against this virus. And just make sure you're following the label restrictions and label instructions and using it properly. Don't use things in the bathroom that aren't certified to use on food, and so on.
Very good point. Thank you very much. So prior to our event, we had a very good question submitted asking, what could someone do to prepare their home in case someone were to become infected in their household? Like, what supplies should they have, or any other special items they should keep on hand? But remember, we don't want to create another toilet paper shortage. So anyone care to answer that question? Dr. Clendenin?
Well, one of the things that's going to be really important is that even within the household setting, that somebody who is positive with COVID-19 is isolating from the rest of the household. That means, staying in their bedroom, maybe having meals put kind of on the floor outside their bedroom door so that they can come and get it and eat in their bedroom. Also, cutting down on the need to disinfect by using things that are disposable, plastic forks, plastic spoons, napkins, paper plates, those types of things, are one and done, and that can help stop that transmission there. And also, believe it or not, a lot of people still like to use the little cup in the bathroom where everybody puts their toothbrushes in the same cup. That kind of needs to stop as well. So anything that you can do to keep the person with COVID isolated, the materials that they're using that could potentially, be fomites and transmit the disease, keeping all of that disinfected and separate from everybody else as well.
Great.
And I'll go off of Dr. Clendenin's comment there and say the common bathroom cup should go away despite COVID. Addition, one of the other things that I would add in is if the individual's in a bedroom, and they're going to have to leave the bedroom to go to the bathroom or other things like that, make sure that they're wearing a face mask or a face covering when they do so. Remember, they're the source of the disease at this point. They're the source of the virus. So anytime they leave that area where they're self-isolating themselves, you want to make sure that they're donning a face covering.
That's a really great point.
I was just going to say some of these things at home really require a lot of creativity. So these are not, despite the fact that mom has been telling us most of these things for most of our lives, and she's right, they are going to help prevent disease, hand washing and hygiene and cleaning the bathroom. But we kind of need to be creative, right? So we may not need to rush out to the store and really stockpile everything because, we can get some of these things delivered now in this day and time. And then also just with our family members, sort of being creative how we can maybe dedicate one bathroom to an individual if that's possible. And then also those of us who are involved with messaging and providing information, recognizing that's not always possible in all households. So being sort of creative about how we help people to be isolated and remain quarantined.
Great. Thank you so much. So we want to make sure that we try to stay on time and answer as many questions as we can. I'm sure we could continue this conversation for a really long time. But viewers, now is a great time for you to present us with any questions in the Q&A button on your screen. If you have any additional questions about COVID infection, we will do our best to answer as much as we can. But for now, we're going to move on, and we've kind of already been on the topic talking about the virus's transmission. So Dr. Gibbs, as you know, many people are really worried about this idea of returning to work or sending their kids back to school. And there's been a lot of debate over virus transmission, including some changes since the beginning of the pandemic to now and what different organizations might be saying. And we've had many viewers ask us about the virus being airborne. What would you say is the most recent research telling us about the virus and airborne transmission?
So the first thing I will tell you is, remember, this virus, to our knowledge, has only existed for less than a year. So we're still learning things about it on a daily and a weekly basis. I mean, the information is constantly evolving. So to kind of put this in perspective, the flu, which we're all very familiar with, there's still a lot of debate in regards to how the flu is transmitted. And we've been dealing with the flu for centuries and centuries and centuries. So kind of what I'm telling you, or what I'll tell you about the transmissibility of the SARS coronavirus 2 that leads to COVID-19 is just best available information right now. So our best available information right now is the primary source of spread is contact with an infectious individual. And that's getting within proximity to them. That's physically touching them, that's interacting with their saliva, through kissing, hugging, other things like that you'll have that direct contact. But it's also being within that 6-foot bubble. For those of you guys who are watching this at home, you're lucky. As all of us are talking, we're just spitting all over the place. So I'm staring at my laptop right now, and I'm just spitting all over my laptop. So if you and I were having this conversation in the room and you were this far from me, I would just, as I'm talking to you like this, little droplets of spittle would be landing all over your face, getting into your nose and mouth and your eyes and so on. So that's what we refer to as droplet transmission. So that those droplets can then go from me to you and can infect you. And in order to infect you, there has to be a dose. Now, we don't know what that dose is for sure yet. What we're seeing is generally it takes a bit of contact So you generally have to be interacting for someone for about 15 minutes or so in that close contact with them spitting back and forth to you. Now, is this airborne? One of the things I want to say is when it comes to transmission dynamics, we go from droplet transmission to airborne transmission, and there's not a defined step in between. Now, I'm part of a group of scientists who believes there needs to be a defined step in between. So what that means is when we talk about airborne transmission, you think of things like tuberculosis, where you can come into a room and enter a room 45 minutes to an hour later and still be infected with tuberculosis. So with this disease, we have seen some evidence related to what I would term as aerosol transmission, which is essentially people being in proximity for aerosol generating procedures and other things like that, and they've been infected. So we're not seeing that as the primary source of transmission. The most you can do to protect yourself is protecting yourself against those droplets. So when we're talking about that short distance air transmission or aerosol transmission, there have been a few examples. Most of it has been in the healthcare environment where you have very high loads of the virus going out into these aerosols, and you have healthcare workers who are exposed to them over prolonged periods of time. Another example that people point to is there was a choir in which there was a lot of singing. For those of you who are vocally gifted, I am not. I'm not going to be singing for you today. You don't want to hear it. You know that when you're singing, you're projecting quite a bit. So in that case, it's very likely that those individuals became infected from that short distance airborne or aerosol related transmission. There was also another case that occurred in a city in China in a restaurant, and this is the one that gets a lot of attention. So what occurred in this restaurant is people who were not sitting at the table as the person who was infected became infected, and people have attributed that to the air conditioning unit in there. Now, I want to be very clear that that air conditioning unit was not the kind of air conditioning units that we're used to seeing in Texas or here in the United States. It's what we refer to as a split recirculating air conditioning unit. So it was recirculating air within the room. It was also a smaller confined space. So it was recirculating cool, dry air, which is ideal for this virus to survive. So it was moving cool, dry air and pushing it across the room, throughout the room. And those people most likely became infected through that route. So the question, is it true airborne transmission? We just don't know yet. Is it likely that aerosol or short airborne transmission is likely? I would say yes, but I would spend most of your time worried about social distancing and those droplets, because by minding your social distancing, you're going to reduce the likelihood of any type of airborne or aerosol transmission.
Well, I have
Dr. Gibbs, just to underscore, right? These are not, it's not that you need to feel spit hitting your face to know, right? These are microscopic. And so that's the important point here.
Yeah, that's the important thing, is it's microscopic. We've all had that situation where we're talking to someone and we see that droplet of spittle. That's just one of tens of thousands that are coming out of you. That just happens to be a larger one. Now, those spittle do also will go down and contaminate surfaces. So that's why we're talking about the importance of cleaning, is because you can do what we refer to as fomite transmission, which is just a fancy way of saying, I spit on the mouse from my computer and then someone else touches it shortly thereafter and then rubs their eyes or touches their mouth. So that's one of the reasons why cleaning frequently becomes important. Now, again, fomite transmission is likely not one of the primary routes. It's going to be that primary interacting with someone back and forth, but by doing regular cleaning, you can help reduce the likelihood of that as well.
You have given us a lot of information in one answer, but let me tell you, you hit probably 10 or so questions that were submitted ahead of time from today's broadcast. So thank you very much. You may have also given many of us with your very great description of talking with someone closely, a new definition to maintaining our bubble. So just let me ask a quick follow-up, because you did talk about air systems in that one specific restaurant case. We've had a couple of people ask about what are the risks, and let's focus on what happens here in Texas when our buildings do like ventilation. Well, an untimely visitor at my home. Hello. It's probably a delivery from Amazon.
Toilet paper.
it could be toilet paper. It is that time for my monthly delivery. So what we would like to know is ventilation and AC systems here. Do we need to be worried about it? Do we need to express concern for people who are sitting or have their desks positioned near a specific air vent? Or is there something that they need to put into their buildings or workplaces like HEPA filters or ionizers that we need to worry about? So just quickly build off of that, because we need to move on to the next topic, if you don't mind.
Many of the HVAC systems out there can be adjusted to reduce the likelihood of disease spread. These can be adjusted in buildings to increase the amount of fresh air coming in, reduce the amount of recirculated air, and increase what we refer to as air changes per hour. The more air changes per hour that you'll have will essentially dilute the amount of virus that's in the environment and remove it from the area. Now, with that being said, not all HVAC systems or heating and ventilation and air conditioning systems are created equally. In order to adjust some of these, it would take tens of millions of dollars or so to make these changes. Many of us in our own personal homes and residence or places that we're used to, you would not be able to adjust these in those kind of ways. Things that you can do, which I realize I'm talking to you from an air-conditioned home on an over 100-degree day. Fresh air is not always something that you can do and still maintain the air conditions inside that you want to maintain. But reducing recirculation will help. When you're talking about air coming out of the ventilation systems, there is the potential for some of the virus to spread through home and other air conditioning systems. We've not seen a ton of evidence of that. When I say it's potential, it's again not primary, probably not even a secondary route of transmission. Things that you can do is there are different filters. Generally, the one that from the industrial that most is called the MERV 13 filters. Those can be placed in your systems to help pull out some of the virus. But again, once this virus is in the air, it starts dying fairly rapidly. We've probably seen the research studies that talk about the virus survived in the air for up to 3 hours. And that's true. The virus can survive in the air for up to 3 hours under ideal conditions. So those are conditions where it's a lower temperature and it's a lower amount of humidity. I'm keeping it 74 degrees in my house, and just the standard humidity is over 55, 60%. The conditions for these is 40% where you see that. So in addition, while it was detected after 3 hours, remember it started dying off. So it was put out into the air at essentially what we refer to as 10 to the 7th. So that's millions of viral particles were put out there, and then they were able to cover 1 or 10. So while it was surviving and available to be recovered in the air, there's still a question as to whether or not that would be an infectious enough dose to make someone sick. So my answer to that is if I were wanting, in my own home, what I'm doing, I'm not readjusting my HVAC systems. I'm encouraging social distancing. I'm cleaning frequently. Those are things that you can do and to make sure that you protect yourself. There is the potential for that kind of short aerosol airborne transmission, but it's likely not the primary route of transmission. You're more at risk by interacting by people closely within that 6-foot radius.
I'm muted again. Thank you very much. That was really great information. But I'd like for us to now, if you have questions about transmission, please feel free to go ahead. And I see that we've been getting several questions submitted. Please, again, submit those in the Q&A box. But we're going to move on to talk about prevention. Dr. Fisher, at the beginning of the pandemic, there was much concern about COVID-19 being able to live on surfaces, and I think we've started to touch on that a little bit. We've had many questions submitted about how long the virus can live on a surface and when it would still be able to be transmitted. But more importantly, a lot of questions asked about, do we need to disinfect our mail, the packages I just received on my front porch, or even our groceries? What would you say?
Yeah, so I think that Dr. Gibbs has covered most of this question, which is great. And And I just want to say that I think that this is not a major source of transmission in our community or others. And Dr. Clendenin probably can also help answer this question. You know, in our community here in the Bryan College Station area, like all across Texas and the United States, I think I would really boil this down to three kind of major sort of events that are transmitting. So travel, where individuals travel to somewhere and bring it home, or they're somewhere where COVID is pretty prevalent and they take it somewhere else. And then within households. So within households, and again, this could be either through a surface that exists in the household where somebody has transferred virus, and then another person picks it up, or through this close contact that is just oftentimes unavoidable in a household. And then at social gatherings. So failing to remain physically distanced. And again, you know, we have infectious individuals in the community, as I mentioned earlier, that don't know they're sick yet, and inadvertently can be spreading to others. And you know, those symptoms in an individual who's going to develop symptoms don't show up for 5 to 7 days. So there is a gap of time there that you just don't know, and you're kind of waiting to see what happens. So I think these things that you mentioned with mail and groceries and packages coming, these are the least of our concerns. If there is a transmission event that happens that way, I certainly haven't seen evidence of that being the main source of transmission anywhere. And as well, I think we have other areas to focus on that are real areas where we can prevent spread.
Well, and
Thank
with
you.
your permission, Heather, I'll hop in there a little too, because I'd like to second everything that Dr. Fisher just said.
Great.
Additionally, the studies that have been out there that show survivability on various surfaces, I just kind of want to put those in context for our listeners. So these are laboratory-based studies which provide us scientists great information to kind of extrapolate from, but they're done under ideal conditions, and they're done with very high viral loads. So one of the things that you guys have probably seen and heard a lot is the virus can survive for 3 days on surface X, Y, or Z. What you need to understand is it starts off with millions upon millions of viruses being put into a droplet onto that surface, held under ideal conditions, and then measured multiple times over multiple hours. And then after 3 days, they're still able to detect 1 to 10 viruses and able to pull that out. So just to put that in perspective, remember earlier when I was talking about spitting all over my computer, if I'm infected and one of those little droplets are coming out of my mouth, that droplet probably only has between 10 and 100 viruses in it. So by the time it dries out and lands on the surface, it has a small number of viruses. And then as time goes by, it's going to die even further. So this is very important that these are not going to be our primary areas of exposure. You're far more likely to hurt yourself by microwaving your mail or doing something like that. And I say this as the son of a letter carrier. In 2020, there's probably nothing so important in your mail that it couldn't wait a day or two if you're really nervous about it.
Good and fair point. And yes, please don't microwave your mail. Well, you did touch a little earlier talking about being outdoors, and in Texas, you're right, it's definitely summer, definitely in the Brazos Valley with the temperatures this week to prove it. Just to go back and ask a follow-up question about knowing that the virus is fragile, doesn't last very long outdoors. Several people asked questions about having outdoor gatherings, and obviously social distancing plays a big role there. But Dr. Clendenin, one of you were asked specifically if we're walking in an outdoor park space, is it okay to not have a mask on if there's not a lot of people around?
So it goes back to the whole idea that we've been mentioning repeatedly it is about the social distancing, and there's a reason why we're trying to keep gatherings small. Outdoors, obviously it is safer because there's more air circulation. But, again, you can drive down the highway and sometimes you'll see family gatherings of 30 or 40 people out in the yard around a barbecue pit, and they're all sitting practically on top of each other in a yard. And in that instance, being outdoors isn't necessarily going to mitigate anything. It's better obviously than being indoors, but if you're just walking through the park, let's say you're walking down the path and someone's jogging towards you or riding a bike towards you, spread yourself out a little bit and get past them, and then you've minimized the opportunity for exposure and transmission.
Yeah, Dr. Clinton, I think that's, you hit on some really good news, and that is these activities that we can do for our physical and emotional well-being in this kind of crazy time. Some of these are safe. We can get out and go for a walk. We can walk our dog. We can go for a little bike ride with our families. This is some really positive news, I think for all of us to remember.
I agree. I think many of us are very stir crazy and anxious to be out and about, but we need to be careful about how close we get with the other people. So,
well, and I can't underscore the importance of the psychosocial aspect of that. When you're being told with mandates, face covering mandates and shelter in place orders and things like that, you really get focused on what we can't do. And if we're going to be able to do the things we need to do, we have to focus on the things that we can do. And we have to look at it from a very positive aspect and try to enjoy those things that allow us to engage interactively with people other than electronically.
Yeah, and I'm going to put a little plug in to maybe appease some of our sociology and anthropology viewers and challenge us as panelists, as well as others out there, that we don't want to remain socially isolated and away, right? We want to remain physically distanced. So we want to remain social and engaged in our society, but we want to remain a safe physical distance with physical barriers that are necessary to prevent transmission.
Great message. I really appreciate that. So I guess you could say that our other hot topic of previously submitted questions, or obviously, if you haven't guessed it already, is about masks. So Dr. Gibbs, you are our resident expert on masks. We only have a few minutes left. What would you tell us about masks? What's the difference between the types of face coverings? Which one's the best? How do we clean them if it's reusable? And the very important question that many people have asked is it actually dangerous to my health to wear one?
So I want to point out for our audience that Heather reminded me we've only a short period of time, so that's her polite way of saying, don't talk for an hour. Because she's heard me talk on this for an hour.
Thank you for catching on.
Yeah. So a couple things that I've got some examples here. So early on, you guys heard a lot about N95 respirators. N95 respirators, this is a respiratory protection device. So this is made to be worn by someone and protect the wearer from the environment. These type of masks should be worn by people who are fit tested for them and who are medically cleared to wear them, and should be worn by people who understand their limitations and how to take them on and off. Because when you're dealing with an infectious disease environment, you want to make sure that these can be contaminated, so you want to use them properly. These should primarily be worn and utilized for healthcare workers. So this is where a lot of the confusion around quote-unquote masks has come in, is early on in the pandemic, the Surgeon General of the United States and many others, myself included, were telling the general population, please stop buying these. And the reason why that was being done was because the healthcare workers who needed them, the supply chain had locked up, and healthcare workers who were working in COVID wards weren't able to get respiratory protection. So respiratory protection is not required for the general public around COVID in the majority of situations.
That's a really important point. Thank you.
So what we're encouraging people to use, and I've got my A&M one here, is cloth face coverings. Cloth face coverings are not respiratory protection. What cloth face coverings do is, remember earlier when I was telling you I'm spitting all over my computer, and now you're all concerned to use the computer after me? What these things do is, when worn over the nose and mouth, these will stop these droplets from coming out, and they will catch a lot of those droplets. So that way, when you're in those situations and you're wearing this mask, those droplets will be what we refer to as arrested or stopped on the material. So it won't have as much potential to go from one person to another. Now, these are to be used to augment with physical distancing, to echo Dr. Fisher's very important point before with physical distancing, because these don't stop 100% of particles. And as we know, they're not all made equally. So you want one that's got at least 2 layers and preferably an inner thicker layer. The most important thing that I would say in regards to wearing masks is making sure you have one that fits comfortably for you. So the masks that we're asking the public to wear are not about protecting the person wearing it, but are about protecting others from the person wearing it. So the more people who are wearing this, it reduces the likelihood, as Dr. Fisher and Dr. Clendenin mentioned earlier, it reduces the likelihood of those people who don't know they're sick yet, but are still able to spit out and put out that virus in the air. So it really helps protect us all. Here at A&M, we've been encouraging people, one of our core values is selfless service. And what we've been telling people is really wearing the cloth face coverings help protect others. So it's part of our duty under selfless service.
Fantastic. So how would I care for that face mask? What do I need to do? How often should I wash it?
So the cloth face masks, you want to probably wash on at least a weekly basis, but it also depends upon how long you're wearing it. If you're wearing it in a situation and you're only wearing it for about 15 minutes, do I then place it into a paper bag in my car and not worry about it for the rest of the week? Yes. But you want to make sure that you keep these fairly clean. So you can just wash these with soap and water, depending on how they're made. The soap and water will take care of the virus. One of the things that I do is with ours is we'll just hand wash them in the sink and then allow them to air dry like you would your laundry delicates, and then you can use them again. You don't want to coat these with chemicals. Some people have talked about spraying things on them. You probably don't want to do that because you don't want to be inhaling those chemicals. The purpose of this mask is just to stop droplets coming from your mouth and going to other people. Now, some people have talked about health issues associated with masks. The cloth masks are very similar to the surgical masks, although different materials, but the similar theory that surgical masks are. Surgeons wear surgical masks for 8 to 12 hours at a time during surgery with no health effects, no cognitive decline, no mental or physical issues. It's not an enjoyable experience, but it's not something that you'll have huge buildup with carbon dioxide or other things like that are not something that occurs in cloth face coverings or in surgical masks. And with that, I'm going to be quiet because I realize I've gone long.
I'm really usually proficient at unmuting myself. Really quickly, one question that was asked is when we store them, you mentioned like putting it in a paper bag and putting it in your car. Is it okay to leave masks in the car? I know that we've had a couple of questions asked about that, but I can personally say I've seen people driving around with them like hanging from their rearview mirror.
So I wouldn't recommend hanging them from your rear view mirror. While they're made to stop your droplets, as you're interacting with people, it's possible that their spittle is getting caught on the outside of this as well. So it is potentially a fomite transfer issue there that we talked about earlier.
Good.
So I would not recommend hanging these from your rear view mirror. How you should store a face covering is generally in a paper bag or another container that allows for airflow. You don't want to take something like this and stick it into a Ziploc type bag and seal it up where there's no airflow. That's a good way to come back to it a day or so later and find it covered in bacterial or mold growth just from your own moisture and so on being captured in there. What you should do is when you're done wearing this, place it into a paper bag and then put that bag in whatever location is safe for you. And then when you're ready, pull it out and clean it.
Thank you. Very good information for all of us who are now in the process of buying masks for the coming school year, for going back to work, and in some cases worrying about whether or not they match our clothes. So we're going to now wrap up the discussion about prevention. And so viewers, if you have questions that you would like to ask, please put them in that Q&A box and we will do our best to get them answered at the end of our hour. But as we wrap up, we had many questions submitted about our last topic, about returning to work and to school. As the school year really is very fast approaching, as summer comes to an end, parents and teachers and administrators have been asking the question of, is it safe for our kids to go back to school? And I think that that's common not only here in the Brazos Valley, but everywhere. So Dr. Fisher, how would you answer that question?
Well, this is a very loaded question and a lot to unpack here, but that's okay. I know it's just really on the forefront of everybody's minds right now, especially as we get closer to school starting. So first and foremost, it's important to listen to local guidance and recommendations. So in Bryan College Station area, you guys, the Brazos County Health District is so good at what they do. One of the most excellent epidemiologists leads that department and the COVID investigation there. If you're on social media, follow their messaging, not just about COVID, but really just good health messages out there. So this is going to be an excellent source of information. Your local health authority, Dr. Sullivan, is just really tuned in to what's going on. He is checking the pulse all the time of the epidemic. So he's really going to advise you in the best way he knows how. Now, regarding kids, we know that kids seem to be diagnosed with COVID less frequently than adults are, but it doesn't mean that they're not important in transmission. And remember, all those children that go to school together come home to families. So you may have family or personal reasons that you would have your child at home if you have a very high-risk household, for example, and having social interactions is particularly dangerous for you. That might be something in a personal decision to consider in addition to the local guidance. And then another thing I think is going to be really important is educating our children. There are some really good resources out there to educate children about what's going on right now. Talk to them about why are we wearing masks? Why are things different right now? And this is going to help empower them and take some of the fear and anxiety out of their day and their interaction. They may be required to wear masks and do things that they're not just used to doing in an everyday life at school, whether that's in-person school or a remote school. So these are important. And then, parents, the same thing, because parents are going to need to be educated as well, because kids will come home with questions. They're questions about other kids and worried about their friends who are testing and waiting for their results or who tested positive. So these are important things that we need to think about when returning to school. And then just a moment to the college kids, because we're not just talking about little kids, we're talking about adolescents and adult children that many of us have. And we're really concerned about this age group. There's sort of this sense of invincibility out there, children and young adults, and nobody really is immune from severe disease. So really all ages could suffer severe disease and all ages can suffer fatality. So every infection, every transmission event is important and could result in a severe disease. And whether that's us who is getting sick or somebody we know or a family member, a child or a classmate, it's important. And for those adolescents and the young adults, we really need to try to speak your language. We're trying to find a way to make this real and important and convey the urgency. And so those of you who know how to talk about this in your social circles, please do so. Help us out. We really need this message to get out. We need, Texas A&M students want to come back. Football wants to happen, but it's really going to take us as a village and as a community to get the schools back functioning in a way that students really want and teachers really want, and probably some parents want.
Most definitely. Dr. Clendenin, many people asked about prevention in the classroom, and I know you do a lot of classroom instruction at the university. What best practices would you recommend to minimize the spread of the virus during a face-to-face class?
So obviously, again, it goes back to the same things that we've been talking about, trying to create a classroom environment where students can be physically distanced from one another and to be using face coverings. Also being respectful to the others in the classroom. If you are not feeling well, or if you think you've had a potential exposure, don't come to class, regardless of if it's COVID or you just ate something bad at the restaurant last night and you're not feeling well, don't come to class. And that's going to be really key. There's only so many components of that environment that we can control. There's been some literature about, elementary schools in other countries where they are able to open up windows and increase some of the circulation in the classroom. They're reducing class sizes in half, where some students cohort in the morning and some cohort in the afternoon, and they stay in those limited cohorts throughout the rest of the school year. But we can't always do that in our classrooms here. So we have to make use of the tools that we have, and we also have to encourage that individual sense of responsibility that when I come to class, I'm going to respect the physical distancing requirements. I'm going to respect the mask or, mask regulations for my classroom, but I'm also not going to be around people if I don't feel well.
Very, very good advice. Thank you. So we're going to ask our last pre-submitted question of Dr. Gibbs. There are many places that people could access information about best practices for the workplace, for returning to work. But we've had a couple of questions that were submitted asking about what should they do for like a small office space with a couple of people compared to if there's a large office space that's more cubicle based. I know that people want to know, how can I do this 100% safely? But we also know that that's sort of almost impossible to achieve. So what advice would you give for those people who have those businesses and workplaces that might be small or large?
So a couple of things to unpack there. So the first thing is the thought of 100% safely. That's just not possible in the world we live in. To be honest, that was never possible in the world we live in. Being 100% safe has never been there, and particularly in a COVID environment. All we can do is reduce the risks and reduce the potential for transmission as much as we can. So what you can do if you're in a small or a large business, and by the way, I realize right now, myself, Drs. Clark, Clendenin, and Fisher, we're very fortunate. The majority of our jobs we can do via distance. We can do via Zoom. We can do other things. We don't have to physically be at another location 40 to 80 hours a week. There's a lot of people out there where that's just not possible. They have to be there 40 to 80 hours a week to put food on the table and so on. So businesses are going to start opening just because people have to continue to feed their families. So as that's being done, as different supervisors and groups are looking into this, the first thing and the easiest thing that you can do, take a look at the layout of your office. Whether it's a small office, a large office, or whatever you can do, implement those social distancing. Colorful tape is now your new best friend. Put that down to let people know where they can stand. Let people know where they can go. So rearranging the furniture to increase that physical distancing from one another. The other thing that you can do, face coverings and face masks for everyone. Those two things alone will reduce a lot of your risk. It won't make you 100% safe because nothing will, but it will reduce a lot of your risk. Other things that you can do, regular cleaning schedules, putting up hand sanitation stations, reminding people, and I was a fan of this all along, to wash their hands and to do it properly. Seriously, when you're washing your hands, soap, water, get both sides. We always say, sing happy birthday to yourself, or out loud, silently or out loud, but go through it twice to make sure you're getting there. Those are the kind of things that you can do, whether you're in a small or a large office, to really protect yourself. You don't have to go overboard with a lot of expensive technologies. You don't have to go overboard with re-engineering your entire facility. If you maintain physical distancing, if you maintain face coverings, encourage hand hygiene and all this stuff, you're going to reduce a lot of your risks.
Thank you so much. Very good advice. Well, we have had several questions submitted, and we want to make sure that we try to get some of these answered before our time is up. So the first one that stands out, Dr. Clendenin, a viewer has asked, is contact tracing and contact investigation the same thing?
So those are two different things. We have case investigation, where someone is identified through a laboratory confirmation that they have COVID-19, and that becomes a case, and that's submitted to the local health authority for investigation. And that's where I talked about, we try to get a better idea of any underlying health conditions that could lead to complications. Were they hospitalized? What was their ventilation status? as well as what were their symptoms. And then we ask them who their close contacts are. Then that gets transferred over to contact tracing, where those people have a little bit less of an interview process. We're really just letting them know they've been exposed to COVID-19. We're asking them if they have access to get testing, because we recommend that they get tested within about 5 days of the exposure. And then, are they experiencing any current symptoms? And we also give them the opportunity to ask us any questions that they may have. So it's two different processes. The interview for a case is a little more extensive than that of a contact.
And I would say that it's probably a misnomer. We should probably call it exposure notification or something like that, because it really is a discussion, and there are questions, health questions to the contact. So that is important to remember, but that's to help guide the information that we're providing to the contact.
Well, it is an important distinction. There's the interview with the person who is infected, but then the information that needs to get out to those who may have been exposed. So very good distinction. Thank you so much. And thank you for the question. Another question that we have, if we had close contact with a large crowd and we have been asymptomatic for 3 days, could we conclude that we are not exposed to the virus? So I think what we're getting at here is, how long can I know, would I know until, or how long until I know that I'm okay?
I'll jump in and answer this one just quickly. You may not know that you will develop symptoms until 5 to 7 days later. So that's the average time for symptoms to develop. Can be as long as 14 days. So if you have been around a large crowd, my suggestion to you is to quarantine yourself for 14 days. If in that time you don't develop any symptoms, then you may be in the clear. If you feel like you are in close contact, then you should probably identify as somebody who may be exposed, and you can present and ask for testing if you're worried about that.
Great. The next two questions are there's two more questions that are very similar, but it's about testing. And so I'll throw it out there, and whoever wants to jump on, answer the question, please do so. A couple of weeks ago, Tom Frieden was on national television and said, as a scientist and an epidemiologist, I'm certain that coronavirus cases are increasing in number due to a spread of the virus, not due to an increase in testing. And a similar question basically was asking, how is a positive case counted? Is a person counted positive once or twice? And what happens if the same person gets tested twice in a 14-day period and they're positive twice? Do they then become 2 cases?
Dr. Clendenin, I can say that each person is counted one time only. An individual is counted once, no matter how many times they are tested. So the numbers that you see that are termed cases are those who are laboratory confirmed cases. There is another category you may see on the news called probable cases, and these are those individuals often that have other tests that document that they had an infection, such as an antibody test, but antibody tests do not identify an acute, immediate, right now infection. So those are the swabs and the saliva tests that you're looking for. So those are the laboratory confirmed tests where they actually detect the genetic matter from the virus on you. And then to the testing question and the numbers going up, and again, I think Angela Clendenin can jump in here too, but we would look at not just the numbers, we look at trends, and we, to the comment of the increase in testing versus the increase in cases, certainly we want more widespread testing as that proportion of positivity starts to increase. It does suggest that we may need more information about, and I should say, and not disproportionate to the number of cases that we're seeing increasing. So often we're seeing the number of cases shooting up, but the number of tests being delivered is not shooting up at the same rate. And so it just raises concern about if we are detecting everybody, if individuals are failing to be tested, we know we have a big access to test issue, which is mirrors often our access to care issues, and so there is widespread disease and transmission in the community, and that has borne out.
Well, unfortunately, we are now out of time. So in just a moment, viewers, you should see a poll up here on your screen. please select yes or no in response to the question that we're asking you, which is, are you interested in seeing more of these types of events from the School of Public Health? If you would please answer yes or no. While you do so, I'd like to say thank you. As our COVID conversation ends, there will be a link to complete an evaluation or comment on our event today, and we really would appreciate your feedback. Please know that our vision at the Texas A&M School of Public Health is for stronger communities and healthier people. We hope that our COVID conversations are one step that we as a school can take to serve as a resource for our fellow Brazos Valley community. Drs. Clendenin, Dr. Fisher, Dr. Gibbs, thank you so much for joining us today. And to each of you, our viewers, please stay safe and stay healthy. Thanks, and gig 'em.